Thank you for joining me today. In this video, we are going to learn more about psychiatric pharmacology. Psychiatric pharmacology is the science of understanding how the receptor-level interventions alter dysfunctional natural circuits to improve the symptoms while stimulating a biological consequence or the side effects. The most important concept is diagnosis is not determine the medication selection, but what determines medication selection include the symptoms cluster, natural circuits, receptor target, patient factors, prior response, risk-benefit analysis, determine the medication selection. For example, if you have two patients, both of them have major depression disorder. First one has insomnia, weight loss, and anxiety. Second patient has hyperinsomnia, fatigue, and low motivation. Although both patients have depression, at the same time, antidepressant may not be ideal for both. This is the essential of advanced psychiatric pharmacology. We are going to explain pharmacokinetic versus pharmacodynamic. Pharmacodynamic is what the drug do to the brain or the body. It includes the receptor binding, agonism, antagonism, partial, extracellular signals. For example, Lexapro blocks serotonin. Risperdal blocks D2 receptor. Abilify partially stimulates D2 receptor, while benzodiazepine enhances GABA receptors. Pharmacokinetic predict effects and the side effects. Pharmacokinetic is what the body do to the drug. What the body do to the drug. Kinetic is the movement that the drug makes in the body. It includes the absorption, it includes the distribution, it includes the metabolism and elimination. The key consideration are enzymes, half-life, drug accumulation, active metabolism, clinical decision-making framework for medication selection include before prescribing any medication, you should think of 5 clinical questions. What am I going to treat? What are the symptom clusters? You want to think about the symptom clusters like am I going to treat the psychosis, depression, mania, anxiety, insomnia, ADHD? So you have to think about the symptoms that you are going to treat to select the medication that works or helps improve, treat that symptoms. Next question will be, what circuit is the dysfunctional? What circuit is dysfunctional? What I mean is, where is the depression is affecting? Where the symptom is coming from? Limbic, for example, depression, are they coming from limbic hyperactivation? If there is a psychosis, are they having a positive symptoms or negative symptoms? Then you want to think about mesolimbic pathway or mesocorticoid pathways. Your third question has to be, which neurotransmitter should I target? If you have the disorder for depression, you want to target serotonin, norepinephrine, and dopamine. If you have anxiety patient, you want to target serotonin and gabapentin. I mean GABA, not gabapentin, GABA. If you have ADHD patient, you want to target dopamine receptor and norepinephrine receptor. Psychosis, if you have a psychosis, you want to target dopamine. Mania, you want to target dopamine and glutamate. Your first question will be the side effects. What side effects is matter? What side effects is that the patient cannot deal with? You want to think about the obesity, depression, suicidal ideation. It can increase some of the psychosis, psychiatric medications can increase that. You want to think about obesity, diabetic, sexual dysfunction, sedation, cardiac. If this medication increased QT prolongation, you want to check if the patient have heart disease. Are they already obese? Do they have a diabetic already? You don't want to increase that, so you want to think about that. And it has to be a decision that you make with the patient. Also, you want to know if they had other trials for this medication. Then your 50 question should be, what monitoring is required? What can I monitor? For example, if the patient is on lithium, you want to monitor lithium level. If the patient on clozapine, you want to assess the ANC or white blood count. If the patient is on fulvaric, you want to monitor LFT. If the metabolic parameter, you want to monitor the metabolic parameter for the second generation antipsychotic medication. For antidepressant medication,